So in my last video, we talked about diabetes mellitus. Now let's talk about a condition that is often confused with diabetes mellitus simply because of the name, diabetes insipidus. This condition has nothing to do with blood sugar, as I said before. So what is diabetes insipidus? It is a disorder where the kidney cannot properly regulate the body's water balance due to problem with the ADH, and this ADH is a hormone that tells the kidney how much water to keep or release. Now let's break it down more. ADH means antidiuretic hormone, and it is produced at the posterior pituitary gland. Anti means something is against, while diuretic means to release or let out water, especially a bunch of water. So when this ADH that is supposed to prevent or that is against too much water from leaving the body is too little, what is going to happen? There's going to be too much water leaving the body because the antidiuretic hormone is not doing its job as it's supposed to because it is too little, and that is what we call diabetes insipidus. Now, let's talk about the types of diabetes insipidus. 1. Central diabetes insipidus. 2. Nephrogenic diabetes insipidus. 3. Gestational diabetes insipidus. In central diabetes insipidus, the brain does not produce or release enough vasopressin, also referred to as antidiuretic hormone, and it can be caused by 1. Injury or damage to the hypothalamus or pituitary gland due to surgery, head trauma or tumor. 2. Infection or inflammation affecting the brain. 3. Genetic disorder that affects the production of vasopressin, that's ADH. Nephrogenic diabetes insipidus. Here, the kidneys are unable to respond properly to antidiuretic hormone or vasopressin, and it can be caused by 1. Certain medications such as lithium. 2. Chronic kidney disease. 3. High or low level of certain minerals in the blood such as calcium or potassium. 4. Genetic defects that affect the kidney's ability to respond to hormones. And then we have gestational diabetes insipidus. This is a rare temporal condition that occurs during pregnancy, and it is caused when the placenta produces an enzyme that destroys the vasopressin, or when the body produces more prostaglandin, which is a substance that makes the kidney less sensitive to hormone. But the good news is this condition is resolved after childbirth. Symptoms of diabetes insipidus. 1. Polyuria. You'll be passing large amounts of diluted urine. 2. Polydipsia. You'll be feeling constant and intense thirst. 3. Dry inside and dehydration. Because of excessive loss of water, you will be dehydrated, and because of that, you will also feel dry skin and dry mucous membrane. And then 4. Tiredness, decreased blood pressure and increased sodium level. So what is the treatment for it? Encourage fluid intake to anyone suffering from it because of dehydration. And then IV normal saline can also be administered. Daily weight check, and also monitor for seizure because electrolyte imbalance can cause seizure. Then administer desmopressin or vasopressin because they imitate ADH and then causes the body to hold on to water, control urine output, and then maintain fluid balance.